All right, welcome back to the program and time for our health conversation this Tuesday morning. Our focus centered on matters mental wellness. That's what we want to focus on, at least today, with the recent data from the World Health Organization indicating that 1 in every 4 Kenyans suffers from mental health. So what exactly can we do as a society, as a community, in breaking that issue as it pertains to mitigating matters to do with mental health? My guest is already on set. That is Dr. Evangeline Wangechi. She is a public health practitioner as well as a trained therapist, and she'll be helping us understand more about mental wellness. Welcome to the program, Dr. Ari.
Thank you. Appreciate it.
All right, let's start with the fact that you've been in both two places. You've lived in the States, you've been in the country here in Kenya, and I just want you to paint for us a picture in terms of the comparison, how mental issues or mental health is dealt with in terms of quick response in the States and in Kenya.
Okay, I want to say thank you for this time. And just before we go there, I just want to applaud the Kenyans, because for us, the fact that we are having this conversation, that means we are open to, increasing that mental health awareness. So this is good. As far as my experience, I've been in the field for 15 years, right? And so running community mental health organizations, and definitely there are some differences. There's something we call the one-stop shop, where someone is found drunk and then they come to a clinic, so they're not being punished by whoever finds them under a bridge because they're drunk or they're high on weed or marijuana, but rather you bring them to a mental health clinic where they'll find a team of professionals that they can take care of them. I think the big point here is that we don't punish people because they are high on weed or they're drunk. No need to put them to jail, no need to put them to prison. But how can we help this person get treatment, and then, of course, be a productive member of the community? Yeah.
All right. So I want you to tell us the comparison, because basically that's what you've just talked about a bit in terms of that one-stop shop, but you haven't really expounded on that. There's so many conversations surrounding the fact that in the West or in the States, there's so much urgency when it comes to dealing with mental health. But when it comes to the African continent, and even particularly here in Kenya, we don't treat it with the urgency that it needs. So that's what I want you to bring out.
Yeah. So what the one-stop shop means, it's an integrated health care. So where you take care of the person as a whole. When I'm looking at you, I'm looking at the whole person. I'm not just thinking about someone has depression, they present with depressive symptoms or a depressive disorder. I think about are they homeless? Do they have safety? Do they have a safe environment where even after they see their therapist and we let them go home, they will feel safe? So the one-stop shop is this whole clinic where someone can come for physical health services, they can come and see their therapist, and if they have alcohol or substance use issues, they will be seen in the same environment. They have peer support specialists because they speak the same language. They can relate to the issues. So it's making it convenient for the person who is struggling or is having these mental health challenges. So making it so convenient for them to a point that we are supporting them and we're not punishing them.
Okay, so when you come back to Kenya, do you feel, in your perspective, I know you've been in the States for a very long time, but would you just perhaps have that feeling that maybe that's what we are lacking? We don't provide that extensive support to our own. We don't take it with the urgency and the seriousness that it deserves.
I think there's always room for improvement. Just because I am in the US, it doesn't mean we are perfect. There are areas we are still working on, right? However, collaboration is needed. We need to collaborate with different systems. We need to collaborate with the community members. We need to collaborate with the members of the clergy. We need to collaborate with the police department. We need to collaborate with the local hospitals so that we all can come together and help this person and see what do they need, what are their needs. And then one, in public health, we call it the social determinants of health. It's a whole checklist of, their relationships, their well-being, their physical health. So really, I'm not sure whether we are there yet in Kenya, but I'm a Kenyan, so I have hope that the more we continue these conversations and having the right people in the right place to help the system and work the system, we'll get there. We'll get there.
We'll get there.
There's hope.
Of importance that there's hope.
Absolutely.
All right, you have an expansive knowledge on matters mental health, and you've also been involved in developing and implementing trauma-informed and integrated healthcare programs. So I want you to just break it down for us, what this entails and what it's all about.
The integrated healthcare?
Yes.
So I'll give you an example. You go to one of the supermarkets here in Nairobi, right? And you can come out with shoes, you can come out with milk, you can come out with bananas. You can buy clothing if you want.
Yes.
So it makes it so convenient for you, or for us, the shoppers, right? It makes it so convenient for us that I don't have to go looking for a store for shoes, another store for milk, it's time consuming. It's almost wastage of resources. But when you create this beautiful clinic where the person identifying with these mental health challenges can come to this healthcare clinic, they can actually come into, we call it a crisis unit. It's almost like an emergency unit, right? And then they find a team of professionals, the peer support. They find the nurses. They find the social worker who actually assesses their mental well-being. They assess their physical wellness, their physical health. And then they are able to triage them, if need be, with the local hospital. All right. Once they're cleared by the hospital, then they can come back to the community mental health clinic for more assessment. And if, let's say, for example, if it's alcohol and they need detoxification, they need to go through the detox, so like a rehab, we have it here, right? Like a rehab. Then they can come back to the clinic and then keep them there for a few days under observation, making sure that, as they detox their system, they're safe. Their physical health, we must check it. Their mental health, we must make sure that they're doing well, and we're assessing them. And then from there, before we can discharge them from the detox unit, we circle them back to an outpatient program. And the outpatient program is where they find a social worker, they find their primary care physician for their physical well-being, and then their peer support specialists and case managers. They're so important. And at the same time, we are checking with them after we discharge them. Where else are you going? Are you going home to a safe environment, or what's the next plan? Yeah.
So this is a one-stop shop for everything as it pertains to matters mental wellness. How long has this program running? What can you say about the success stories?
Number one, we talk about transportation, right? So the person doesn't have to go to traveling to all these different places looking for my doctor's office, right? Or my therapist, the social worker, or where is my peer support specialist? So number one, we make it very convenient for the patient. We also make it so friendly, because it needs to be friendly, that there's no judgment. You've gone through this life, because life is full of challenges. We've all been through some challenges.
Yes.
And so we want to make it as comfortable to this patient as we can. And therefore, that is why such an environment is important. And then, of course, with their physical health, we are monitoring them. How are they doing? Yeah. And are they receptive to the treatment? And so there's daily and constant encouragement why treatment is important, and then follow-ups. So, of course, we have to hold people accountable in the sense of, I need to see you for your session or for your appointment. But if I don't see you, I'll give you a call.
You go the extra mile.
We have to go an extra mile, because these are our sisters and cousins, and these are people. It's only that a day, life happened for them, maybe trauma, right? Or unfortunately, their childhood wasn't as pleasant as others. So I think we need to shift our focus and be more forgiving as a society. We need to be gentle with people. This idea of just judging, but you don't know my story. If you knew my story, maybe you would be a little bit more soft, So I think we need to be soft. We need to humanize this and normalize the conversation about mental health. And anybody. I mean, if somebody has cancer, we are all over them and taking care of them and loving on them and shopping for them. Can we do the same for these others?
For mental health?
For mental health challenges, can we do some shopping for someone who is, struggling with depression and, PTSD? It would be so important.
Yeah, so that we don't judge you, and I don't judge you, and you've said that we all have a story, and you're so big on mental health, an advocate on that. Thomas does on the same. What is your story? I mean, you didn't wake up and decide, I'd want to start championing for this thing that is called mental health.
Yeah.
What's your background looking like?
I think it's a good conversation, because I didn't get into the field because my story drove me to that, or I was drawn to that.
All right.
I was just curious about, why do people behave the way they do? Why do we make the decisions that we make? What is the force behind it? What drives that? So I went to school, my graduate school, and did counseling, professional counseling. And then I got into the field, of course, and now I was even more curious, because I realized my own childhood environment wasn't what I thought. And that is, there was a lot of
And this you're realizing when you're already an adult?
Absolutely. When I was in graduate school, I was doing my master's then. Yeah. So you can see from my childhood, at the age of maybe between 5 and 11, there was a lot of dysfunction, I lost my mom when I was 10. And of course, that's not something you tell the kids, because the kids are kids and we don't need to explain to them. That was a mistake, And so having struggled with the loss and grief, and not knowing that you're grieving, but you're grieving. And then I go to high school, and all my peers, their moms are coming to visit, but I don't see my mom anywhere. Then I start asking questions. Wait a minute, somebody is missing in the big picture. So you can see the lack of allowing kids to express themselves, and also listen to them, and also asking them, how are you feeling? Yeah. Wow. Giving them a safe environment where they can express themselves, also without judgment, So that, to me, when I was in graduate school, even pushed me to want to do this thing called mental health. Yeah.
That's where you develop the passion, the zeal, the want to just focus on mental health. Let's stay there a bit, particularly when it comes to loss and grief, because we keep saying all the time, and this could be in any area, keep saying, you just need to get over it. Just get over it. And sometimes you don't understand the impact that this has. It could be in a child or even in an adult. Let's talk about the loss and grief just a bit.
Yeah. We don't just get over it. There's nothing.
And there's no time frame to it.
There's nothing like that.
Okay.
The goal is to allow someone to grieve in a safe environment. You don't have to say much if you don't know what to say. I just need someone to be present in the moment. If I need to talk, then I can express my thoughts, I can express my feelings, if I need something, you can say, how can I help you? Or when you're ready to talk, I'm here for you.
Yeah.
If you need anything, let me know what you need. But in the meantime, I'm here. Yeah.
Okay. Then again, from a psychologist's perspective, even just from your practice and your expertise, make us understand, because you would see some people, even 10 years, 15 years down the line, that they're still having that pain, and it takes a toll on their mental wellness. Sometimes it's just 15 years later, and you're sitting with someone, you're having a very good conversation, then they just break down. And they've been really thinking about this thing. What normally is the psychology behind this? How does this have a really long-term effect on someone to a point that they really affect them mentally completely?
Yeah, I think going back to my own story and being in graduate school and then realizing what I thought my childhood wasn't. It's because after, you go to a classroom and you're talking about the underlying issues, and now you're hearing more. There are things called underlying issues. What are those?
Yeah.
Right? One, it's because when we don't address issues in real time, it becomes a long-term problem. So it is important for us to be vulnerable in that moment and address an issue. Unfortunately, what most of us do, we brush things under the rug. We sweep things under the rug of, you need to get over it.
Yes.
Or with time you'll be fine.
I mean, and some would say like Indian Jia yet to sote. All of us will go through this way. So why are you sulking over this? And we sometimes don't understand the magnitude.
Right. And it's unfortunate. So we need to be very sensitive to one another. We need to be sensitive when we are comforting people, when we are with people that are experiencing or rather have experienced loss. So this is very important. Addressing issues in real time. Yeah. It's hard, it's not easy, but encouraging it. That
you need to constantly address those issues.
Absolutely.
Nonetheless. Again, there's another issue of trauma, and just borrowing also from what you've mentioned, that sometimes we tend to think, and particularly this emanates from kids, because it's from what you see in that environment as a child. It grows over time, and we always tend to think, they're just kids, they really don't understand much. And you sit with someone at the age of 26 and they tell you, when I was 6, when I was 5, dad did this to mom, or mom did this to dad, and the environment was very toxic for me. So when you see me act the way I act at this 26 or 30 years, it's because of what I went through when I was 5.
Yeah.
Talk to us about that.
Yeah, most of my clients, maybe you can hear somebody's in their 40s and 50s and 60s and even 70s, and they're literally crying, or they're in emotional pain, very raw, because of what happened to them or was done to them when they were 10 or they were 5. And this is because, of course, those issues were not addressed. Either there was child neglect, there was a child abuse, or whatever. So, and because they were never addressed, now it's the time, because of the triggers again, the underlying issues, they become a trigger. So you may look at somebody that reminds you of your abuser or the perpetrator, and therefore it becomes a huge problem for them. So going through trauma, of course, when you talk about trauma, it's the potential trauma events that one was exposed to that occur during childhood, whether it's child neglect, child abuse, it could be being exposed to domestic violence. So all these issues affect all of us later in life. And that's why the adults need to be the adults in the home.
Okay.
The caregivers, they need to be more sensitive. We need to provide children with a safe environment, whatever the cost, because there will be a cost, but we need to make sure our children are taken care of.
And trauma is one of those areas that you're largely involved in, and that's also part of what this is, the program that you really have been working on. But I also want us to talk slightly about that trauma issue, and just the way you're saying that we need to create a safe environment for children particularly, and also for adults. So then how do we go about doing this? Because you already can establish that it creates a long-term effect, trauma, to these children.
Yeah, for me, from losing my mom at that age and going to high school and realizing I was missing somebody in the picture that was so important, I didn't realize the impact that had in my life. Some of the decisions I made in life, you know, they were not happy, they were not good decisions, you know, because there was another force. Some of the relationships, right? Decision making that were not anything that I would encourage anybody to make such decisions. So again, treatment. Let's get treatment, even for the children. Our children, they need treatment. We need to make sure that they're getting therapy. If there's loss in the home, I wish then there was, I knew what I know now, that something called treatment, and a child can go to therapy and be allowed to express herself or himself in a very safe environment where there is no judgment.
All right.
So as much as we focus on the adults, I hope we can also, you know, as a society, we can also focus on the children.
Why do you think we don't normalize therapy, particularly in Africa?
Well, it's, you know, I grew up going to my neighbors to borrow salt. They were told, you know, go get salt. And my neighbor, I mean, it's like all of us, we are a big family, and that's good. Family is great, but within a family unit, we are individuals. You're your own person. And so, as much as you're told, do not disclose the family business to the public, because it's family. I think then the other question is the family then addressing these issues appropriately? Because if they're not, then it's also a problem. So I think as we talk about the family itself and the society, let's make sure that we are, you know, just get out of the box. I think the days are gone. We can get out of the box and we can embrace the treatment that is needed. Yeah.
So you think that our culture as Africans is one of those inhibiting factors as to why we embrace and we think therapy is normal. In essence, that we don't think it needs to be part of us because of our culture orientation.
It's needed. It doesn't mean our culture is bad. It's not a right or wrong. It's not a good or bad. But we need to be mindful of what is working and what's not. What's not working, we need to set it aside and pick what is working.
Okay, in your practice and handling such cases, particularly even in cases of trauma, what or which case would you say that this was actually those cases that, wow, those difficult, tough cases, or each one of them is just...
Yeah, as far as trauma, we could experience or be exposed to an event, two of us, same time, maybe let's say a car accident, God forbid, right? The car is red, we are both in that car, I get traumatized, and you move on, and you're okay. So trauma is not a one suit fits all. Just because we've been exposed to the same event, then both of us will be traumatized the same way. Maybe you're more resilient than I am, and that's okay. So I just need to work on myself and resiliency, meaning being able to bounce back.
And does that stem from personality or upbringing or life experiences?
Life experiences.
Okay.
Childhood life experiences. Yeah.
So then how can you tell that someone has a mental health problem? Because look at this scenario in a family setup. I mean, you've had so many cases of, we were just having a conversation this morning. I mean, it's in the afternoon, and you go back to the house, or it's in the evening, and the person just committed suicide, and sometimes you just cannot make sense of what exactly happened. I was talking with you on phone, and you looked excited. Everything looked fine. So then how can you tell that someone has a mental health problem? What are the telltale signs?
Yeah, they're symptoms, and especially like death by suicide. Okay. What are the red flags that maybe we missed or the friends missed? I don't want the friends to feel guilty that they missed, you know.
Yeah, because there's a lot of that guilt.
Yeah, you know, there's that guilt and shame and the ifs, you know, what if I called or I had called, or we don't want to run with that. I mean, it's the human brain. We don't know what somebody is thinking, but it does happen. So I think it's for us to look at the symptoms. And when I'm with your, you know, when you're with your friend or I'm with my friend, you know, pay attention. Let's pay attention. So it's not just kahawa time, but how are you feeling? Listening. I like to say listening is the best gift we can give to each other. Yeah. Being able to listen without judgment and being able to observe somebody's body language. Now, we all cannot be therapists, but there are things we can do. Yeah. If somebody shares, I didn't sleep well last night, I won't brush it off. What happened? Pay attention, listen. Yeah. My appetite is low or poor. What's going on? I lost a cousin. How can I help? How may I be of help? So I think it's just, you know, for us is to pay more attention, listen, and ask questions. And if we don't have answers, that's okay. Yeah.
Doctor, aside from body language and appetite, I mean, what are those key things we can look at? Because
agitation.
All right.
Anger is huge. Somebody getting all edgy, you know, you step on their toes by mistake. They're ready for a fight.
And they make a very big deal out of it.
They're ready for a fight. Okay. Or, you know, there's anxiety. There's a lack of sleep. Some people isolate. You know, I don't want to be bothered, don't call me. You call them, they don't answer the phone. Those are some of the things, basic things we need to look at.
So now you've already spotted these things. Again, let's take the very basic scenario in a family setup. What is the best way to approach such kind of people showing this kinds of sign without having to look judgmental, like, why are you just not eating? I mean, all of us are eating, and why are you know?
Every time you ask somebody the why, I'm going to fight for my life, so I'll defend. So there's that defensive mechanism.
So even the language that you use is very important?
Absolutely. Your choice of words, right? So it's not, why are you not eating, or what happened to you, you know, what's your problem? No. This is what I have observed, because it's an observation. Right, I have observed, or I have heard you say that, you know, your appetite is low. What happened? What has changed? So very gentle, going back to just being so gentle and mindful. If we use the why, then I don't know your intention or your agenda. Why are you asking the why? So I'm gonna say something, whatever it is you want to hear, because I don't want to have this conversation.
So it just narrows down to how you approach this person.
Approach is important.
That is what makes the difference, without having to sound judgmental. But others will still say that much as even you ask that in terms of even the language that you use, there are still some factors that will still feel like it's not a safe environment for me. I still feel judged. I'm not okay to open up in this space. Some would even say that I'm opening up so that you can go and have a story to tell other people.
We need to be disciplined. You know, if somebody shares with me how they feel, they're sharing because they trust that that information is confidential. So I need to be disciplined with that information that they share. The other thing is, if they do not feel comfortable or they're not ready yet to talk about whatever it is they're going through, I need to respect that. But remind them, I'm here for you, I care about you, and when you're ready, I'm here. Yeah.
So aside from just having this conversation with the person, could be again
treatment, definitely. Encourage the person. You know, who can we call? Is it your spiritual leader that maybe they feel comfortable reaching out to? Is there a therapist? We need to find a therapist for them. or who do they have that can be of great support. Yeah.
All right, personality disorder in line with mental health. Talk to us about that.
It's a tricky one, I have to. And I would encourage that for people who are trained to work with individuals that have personality disorders. Yeah.
Okay. So it's just for people who are trained to work with
individuals who have personality disorders.
In your practice, have you had to encounter this?
Oh, yes.
That's what I want you to bring out.
What we do is, those who are trained as trauma therapists, they specialize on that. Those who are trained to work with individuals with personality disorder patients, we allow to, so we zero in on what is your expertise. That's the most important thing. Yeah. Some people prefer to work with the adults. Some people prefer to work with the kids. So I think, because you want to have the best outcomes.
The best outcome at the end of the day.
Absolutely.
Okay, again, even as we talk about creation of awareness, because we can keep talking about that, and we are really seeing people coming out, advocates like you, doctors, therapists, talking about mental health. So clearly awareness, at least it's being done here and there. But again, there's still some underlying factors, issues. And just going by what you're facing here as a country, there's that issue of not allocating money or budget towards mental health. Yes, we have the entire health as a function, but we do not put a money specifically, just this is for mental health issues. Do you think we need to do better? Do we need to do more? And in respect to that, what do we need to do?
That's a call to action that's needed. We need a healthy society. We cannot have a healthy society without mental health resources. If my app here is not working,
there's nothing else that's working.
There's nothing else that is working. I will not be productive. My relationships, I'm going to burn bridges. Whether I'm working in the banking system or transportation system or just any level of leadership, or I'm the mama boga somewhere. So if I'm suffering mentally, nothing else is working. My family will be broken. Like, there will be so many challenges even in the family.
So in the West, do we have budgets catered for mental health?
Yes.
Or this is actually an issue that cuts across the globe?
No, we have the federal money, or the national, here it's the national budget. In the US, we have the federal government that provides the funds, and then it trickles down to the state government. And then from the state government, it trickles down to the local government. So the Mwana Inchi will have their share of mental health resources to take care of the citizens.
So there's actually a budget catered for mental health specifically.
Absolutely.
Something that African continent, particularly Kenya, needs to borrow. Because that is part of taking it with the seriousness and the urgency that it needs.
No, unfortunately, some of the chaos that we have seen in high schools, or domestic violence, or just different arenas, right? For us to be able to effectively address those issues, we need resources. We need resources.
We need money to address those issues.
We need the money.
What is the place of physical exercise as it pertains to mental wellness?
We encourage people to, physical health is important. Health diets.
Yes.
Eat healthy. Skuma wiki is good, and spinach. Just eating healthy is good for our mental health.
And the physical exercise is also good for our mental wellness and mental health altogether. All right. Now, there's something I just want us to address even before we bring this conversation to a close, and that is the aspect of job loss, or even just in the working space. We've also had, because anytime we talk about mental wellness or mental health as a whole, you always think about the family setup. Either the parents are not there for the child, or just domestic violence. It's mostly centered around issues emanating from the family space. But we sort of like put less focus on the working environment and the toxicity that sometimes can emanate maybe from a toxic boss or toxic co-workers. Talk to us just slightly a bit about that.
So usually, if I'm not happy at home and I work, So I'm taking all my challenges, all my issues to work. My colleagues will not be happy. They'll have a rough day. They'll have a bad day. So we need to focus on our families. We need to focus on organizations, creating a safe environment. Even think of simple breaks, like a simple break room, where people can freely.
This is in the workspace.
This is in the workspace, absolutely. A good break room where you can go rest for 15 minutes, for 10 minutes. It's good for us. And then go back to your daily business, right? So, and also for the employers to provide resources, for them to provide resources to support their employees.
Well said. Good enough, and a good place to end it.
Absolutely.
I know employers have been watching that. Provide resources to support your employees, very key and important also for the employers. All right, I have been speaking to Dr. Evangeline Wangechi. She is a public health practitioner as well as a trained therapist. Our conversation centered on mental wellness, mental health altogether, what we can do as a society as well as a community to just aid and assist when it comes to matters mental wellness. We ultimately bring Good Morning Kenya to a close this Tuesday. I'm Doreen Arange Okello. On behalf of the entire team, we say thank you so much for watching. We'll do this again tomorrow. Stay safe.